I see a lot of people here with signs from both sides, and I know that this is a passionate issue for lots of people. You see that there are a lot of cameras here. I've actually been interviewed more over the last day about this issue than I have in the entire almost 4 years I've been on City Council. So we should be aware that all eyes, or at least many eyes, are on our city, and this is an absolutely terrific time to show that a city with a wide spectrum of opinion and with differing opinions that are held passionately can engage in sensible and logical and respectful debate and resolve the issue. And as we know, if it passes tonight, it's really an issue for the voters. It's not going to be an issue that we'll decide. The obesity epidemic is new. It's a product of the last 30 to 40 years. Basically, every age group has gotten heavier, but it's not really the issue of the fat we see. It's the fat we don't see. It's the fat that gets deposited in the liver, and it's the fat that gets in the bloodstream that clogs up the arteries that causes heart attacks. It's really not an issue about obesity. Obesity is a marker. It's an issue about preventing diabetes and preventing heart disease and preventing early death. In the packet that I left you, there are references that show unequivocally, medically, right now, it is proven that 1 can of soda a day increases your risk of type 2 diabetes. That is, it causes diabetes, it causes heart attacks, and it causes obesity, and it makes some cancers grow. So this is now new medical information. This is not just a case of empty calories. These are toxic calories. This is a big gulp. 800 calories, 64 ounces, and this is what's in it.
That's all sugar.
Half a pound of sugar. Show and tell. This is the amount of sugar that your child or you eat when you drink 1 can of soda a day for a year. I'm going to put this down in front so you can all take a look at it.
All right, I'd like to ask the audience to please be respectful while we're discussing this. Thank you.
So here's the problem. You drink this, and these are made up of 2 molecules. 1 molecule is glucose, the sugar of life, no problem, related to insulin. Only problem is it's not sweet. The other sugar in there is fructose, fruit sugar. Okay? It's not a problem when it's in an apple, because in nature, fruit sugar is always mixed with fiber. So when I eat it, it gets absorbed slowly, and my liver is fine with it. The Krebs cycle turns, the TCA cycle, I'm producing energy, I'm good. But you put this in water, and you give that to your liver, and your liver cannot metabolize it. So what happens to the extra? The extra gets made into fat. The fat ends up in the liver. So that's what I say, it's the organ fat that's the problem. It's not the fat that's around our waistlines that's the problem. That doesn't kill us. Makes it hard to tie our shoes, but it doesn't kill us. But the fat in the liver makes the liver malfunction, and it causes insulin resistance in the liver, which ultimately results in diabetes. So you get diabetes when you eat this kind of sugar on a daily basis. The other thing that happens is those fats end up in the bloodstream, and they clog up the arteries in the heart, and they produce a heart attack. I spent 30 years of my life at Kaiser Richmond taking care of patients with exactly this problem. We didn't even have a name for it when I started. But this is what kills most people. This is what killed my father. This is what's going to kill our 5th and 7th graders before their time. This is a health disparity issue. I see a lot of people here from all our various communities. You have to know that our 5th and 7th grade African American students, fully 1/3 are obese, and the same is true for our Latino students. It's not their fault. The Institute of Medicine this week in Washington, D.C., at a big meeting, big doctors came out and said it's not their fault. They are being preyed upon by an aggressive advertising which is targeting our children, and it is targeting communities of color. So if you think your child has freedom of choice of what he's going to drink, you can forget it, just like a generation before when people thought it was cool to smoke because the guy in the commercial had the drink, the cigarette, and got the girl. What we now know is when you smoked, you got lung cancer and you died. There will come a time when that can of soda says, caution, drinking this on a daily basis causes heart attacks, causes diabetes. So this is what we need to prevent. Now, why attacks? Why not just educate everybody? That's what people say, oh, there's all grants out there, just educate everybody. There is a science to this. There is a huge public health literature on alcohol, on seat belts, on cigarettes. And what that literature says is we're stubborn. We don't just do so well when people tell us what to do. We actually don't listen. But when we get hit a little bit with a stick, we do. So we need a carrot and a stick. So for seat belts, it was click it or ticket, right? And then we started wearing it. For helmets, it was given tickets for people who didn't wear their helmets when they wore their motorcycles. The whole drive to designated drivers was because there was punitive action. Cigarette taxes have been hugely successful. Don't let anyone tell you, oh, cigarette taxes, I know the guy down the street still smokes. Yeah, he does, but a hell of a lot of other people stopped. And not only did people stop smoking, new smokers did not start. That's what the public health literature tells us. So that's what we are following here. I want to say one other thing. We have been out in the community extensively, talking to community groups. And what people want the money to be spent on are the following. More after-school sports programs and making them less expensive and providing adequate sports fields. Every kid in Richmond should have the opportunity to participate in the team sport of their choosing, or even just a sport like tennis. Every kid. North Richmond, too. We got 5,000 kids engaged in sports. We got 10,000 we can recruit. So we can, this tax could bring in $6 million a year. You could put $2 million into sports. You could put $1 million into a sports field a year, and you could support what? The half-steppers, the Steelers, all these teams, the tennis, and help subsidize that. The other thing that the community wants is to allow schools to provide healthier school meals and have nutrition classes and cooking classes. We have a huge urban ag community here. For $80,000 a pop, you can put an urban ag teacher in every school. We have school clinics in every high school. We could put school clinics in every elementary and middle school as well. And the last thing that people want, and I think this really speaks highly for Richmond and the kind of people we have, is people want us to provide medical care for children with diabetes who can't afford care. The community wants us to look out for our most vulnerable. I have been in, and I think that speaks highly for our community. I have been in discussions, and so has the city manager our county supervisor with the CEO of Children's Hospital of Oakland, Dr. Bert Lubin. It actually is our children's hospital. That's where our children go. And they also provide our outpatient care. They would like to cooperate with us and make a diabetes and obesity center for our children in Richmond. So we can use some of the proceeds for that. So when you're thinking about this, yes, it will inconvenience the corner grocer, just like the cigarette tax did. It inconvenienced people. That's true. But we didn't want our kids smoking, and we don't want smoking. We didn't outlaw it, but we made it a little harder to get. We're going to need to do the same with this to overcome the obesity epidemic. So I urge you all to engage in this discussion. There's a lot to learn. We come from different knowledge bases and from different ways of seeing it. But let's show the world that we can do this in a respectful and constructive way, and we'll all come out better for it in the end. Thank you.
Okay.